I'm Dr. Donald DeFabio with your wellness tip. Disc problems, herniated discs, slip discs respond very well to chiropractic care. My guest is Dr. Joseph D'Angelillo, who's going to discuss that with us today. Dr. D'Angelillo, as a chiropractic doctor, do you treat disc problems?
Absolutely. Every day, chiropractors in their offices are treating patients with disc problems. And I think when a patient hears that they have a herniated disc, many times they think that the only source that they have for a solution is through surgery. And that's the furthest thing from the truth, because there's a small percentage of patients that will require surgery. And in rare instances, if they have a quad equina syndrome or a cord compression in their neck, surgery is absolutely the most appropriate modality. But in chiropractic, there's a whole host of different techniques that chiropractors employ to treat patients with herniated discs. And discs herniate in many different ways. Sometimes they herniate forwards, sideways, backwards. And the important thing is, what is the clinical picture that the patient is presenting with a herniated disc? Some techniques will be lower force, some will be a little bit more higher velocity. Always taking into consideration what's the patient's clinical condition and their tolerance level for the adjustment. So in my office, and I'm sure in your office, you use a whole host of different modalities and techniques. And the primary cause concern is, number one, let's get the patient feeling better. So we may use some ultrasound, electrical stim, things like that to make the patient comfortable to aid in the healing process so that the patient can then receive an adjustment. And in my office, for patients with herniated discs, I many times go to the Cox technique, which is a very gentle technique. And there's always patient feedback, so we always want to stay on the side of happiness. We don't want to cause any pain to the patient. So we're always looking for the patient's feedback, and we work the adjustment to their tolerance level. So there's always a way for a patient to receive an adjustment. Some patients who have a herniated disc may not have sciatica, but the disc herniation is there on the MRI, but it's really not clinically significant in relationship to their symptoms. So sometimes a high velocity adjustment may be the appropriate technique.
So you say high velocity, that's when people think about chiropractic, they think there's a lot of popping and cracking. So when you say high velocity, you mean that style of adjustment, but there's other styles besides that.
Absolutely, yeah. That's the most typical adjustment that patients think of when they think of a chiropractic adjustment. But there are soft tissue techniques as well that patients...
and you said that Cox flexion distraction, where there's a lot of a lower velocity, there's not going to be the noise, but it's very good for those disc type syndromes.
Absolutely. It's very gentle stretching, gentle mobilization through the entire range of motion of the joint.
So the number one goal then is to get the pressure of the disc off the nerves to alleviate the pain. That's kind of the bottom line.
That's the kind of the bottom line, but when a disc herniates, it's not just the mechanical pressure that gets put on the nerve. Many times there's chemicals that are inflammatory to the associated tissues, like the nerve. So when a joint becomes stuck, there is a congestion that sets up around the nerve, and that congestion itself becomes irritating to the nerve, and these chemicals that are inflammatory also produce the sciatica or the brachial radiculopathy. So as the joint is gently mobilized, you're basically imbibing the area with the nutrients and the oxygen and drawing out the chemicals that are causing the inflammatory process.
Really treating the underlying cause of the problem, getting the disc to heal, and enabling the body to get back on track.
Absolutely.
Well, there you go. Chiropractic sounds like the perfect choice to treat your disc problems. So consider that before drugs and surgery if you have a slip disc or a loved one does. I'm Dr. Donald DeFabio. Thanks for tuning in.